You know, living down south, we're out in the sun a lot, and taking care of your skin is very, very important, you know, especially during the summertime. Well, today on the show, we're here talking to Dr. Hunter Phillips with the Biloxi Dermatology Solutions on Pass Road in Biloxi. How are you, Dr. Phillips? Good to
Doing
see
fine.
you.
Good to see you.
Let's talk a little bit about that. I mean, I spend a lot of time out in the sun all year round, actually. My wife and I, we like to go out fishing. I'm also a reserve officer in Marine Patrol, so I'm out in the sun a lot.
Right.
And anybody who is really needs to take extra care with their skin.
Exactly.
What are some of the things that you do whenever someone comes in for an examination?
Yeah. Well, as dermatologists, of course, we are skin experts. We look at the total body skin. The skin is the largest organ in the body. A couple of things we can do. Obviously, we treat anything from acne to cancers. In your case, if you came in for a skin exam and you didn't have any other complaints, we'd look you over, make sure you had no cancers, precancers, and moles, melanoma, things like that are very important to check for that people kind of don't really know how to check, and we kind of educate the patient as well on what to look for, and so they can do their own self-exam.
And that's one thing that is important whenever you're out in the sun. If you see something maybe pop up, you might think, oh, you know, maybe I need to get that checked. Never let anything really go if you have, you know, any kind of suspicion. So what are some of the things that they might want to look for?
Yeah, exactly. I tell patients I'd rather tell them they had nothing than have them come in and say that they should have come in and they only have 3 months to live.
Oh, yes.
So there's nothing that is too small or too inconsequential to be checked out in dermatology. It's very important to have your exams if you feel like there's something that's changing, growing, bleeding, itching, a sore that won't heal, a black spot that's getting bigger. Those are the main things that we look for in cancerous type exams. Of course, dermatologists do anything from, like I had mentioned, acne to rashes to warts to psoriasis. We've got great new treatments for psoriasis. The field has just taken off. We also have great new treatments for melanoma too. I think dermatologists are on the forefront of actually treating melanoma as it relates to cancer in general in the monoclonal antibody and gene therapy treatment.
Do you deal with a lot of the melanoma, the skin cancer here on the
Yes,
coast?
yes.
You see a lot of that?
Yeah, skin cancer is the #1 cancer in the world. It's
To kill people?
yes,
Yeah.
and melanoma kills 1 person every hour in the United
Wow.
States. A very, very dangerous type of cancer. The most common cancer is basal cell cancer. It usually starts with a spot that is either a little pearly, little spot that won't heal, or a little ulcer that won't heal. Squamous is the second most common. It does kind of similar. It starts as a patch, maybe an itchy patch or a little sore that won't heal and gets bigger. And they're very common on the coast, primarily because people are out in the sun. The sun is your #1 enemy for cancer. Sun damage is the primary cause of premature aging as well. And as dermatologists, we also look for that as well. We look for aging changes and can give you some advice on how to prevent some of that as well.
Okay, well, speaking of advice, we're going to move to another room and sit down and chat more about some of the things that you can do to, you know, for prevention, especially living down here in the South in the sun. Dr. Phillips, if you would introduce us to this young lady here.
Yeah, this is Erin Risco, a nurse practitioner. She's expert in dermatology. She's been trained for many years in dermatology. She works with us now here at the clinic and helps me see patients and sees patients on her own as well. She's very educated on what to look for in dermatology and how to treat all conditions.
Well, let's talk about prevention. You know, some of the things you need to do. Again, as we were talking, being out in the sun all the time here on the coast. I mean, we have people are out all year round. I mean, the weather is just allows us to do that.
Right.
But you know, more so in the summertime.
Right.
You know, the importance of protecting your skin and what you need to do to protect it.
Yeah, I think summertime here in Mississippi is April to probably January.
Pretty much so, yes, sir.
So we get a lot more summertime than most places. But the best thing to do is obviously wear sunscreen. The sunscreen is the most important thing you can do besides not go out or stay in the shade, and do a little bit of both. Also wear protective clothing. That's important. Hats, and some people that fish a lot wear or play golf wear long sleeves that they have these new clothes that breathe and have an SPF 30 in them, and they breathe very well, so you don't get the the heat build up like you do with the regular clothes. So those are important to maybe look into as well. As far as sunscreen, we recommend the higher the SPF, the better. It's a common misconception that anything above, say, 30 won't help you any, but really it does. What the problem is with sunscreen is at 30 you're not blocking all the UVA rays, and the higher the number you get, the more UVA you block. And UVA long term can cause a lot more damage than UVB, which is blocked by the lower numbers. So personally, I use an SPF 100 spray on. Yeah, and that blocks pretty much every type of damaging ray in the sun.
And the spray-on seems like it's easier to apply, because if you use cream, I mean, it can get kind of messy, especially if you're sweaty.
Right.
The spray-on seems better. Myself, usually I'll use 30 on my arms and everything, but my face and head, I use 50. Yeah. And I apply it like every 30 minutes.
Yeah, and 50 is probably good enough. You know, you could go higher if you needed to, depending on your skin type. If you're a redhead, I'd say go a little bit higher. But you know, the real key is that you're wearing it,
right,
and that you're reapplying it, and that's really the key. And that you're wearing protection. You're wearing a hat, and so you may get reflective sunlight from the water when you're fishing or boating, but you're blocking that direct sunlight, and that sunscreen is protecting that reflective sunlight. And so you're not getting that damaging rays that are going to cause the skin cancers and aging changes later. You know, the brown spots, the wrinkles around the mouth, the wrinkles around the eyes. The sun is the #1 cause for all that, premature aging.
It happens the older we get.
Yeah, yeah. Unfortunately, you got two problems: gravity and sun. And you can't get rid of the gravity, so
no,
you have to just protect
or the
yourself
sun.
against sun.
So
yeah.
Now we have about a little over a minute left. Talk, if you would, just real quick about afterwards. You know, you're out of the sun, you've taken a shower and everything, the importance of moisturizing your skin and everything.
Yeah, the time to moisturize your skin, of course, is after a nice bath or shower. That's when your epidermal cells are open, and that's when you're going to absorb most of the moisturizer. Keep your skin moist. That keeps the skin from shedding and the keratinization level normal, where it doesn't get thick and you don't get little itchy patches and things like that. So it's very important to moisturize as well.
Yeah, and we're talking about all over. I mean,
head to toe.
Even the parts that aren't exposed to the sun. But of course, most of the time, if you're out enjoying your time on a boat or anything like that, you're definitely going to have sun exposure all over yourself. But then again, as we mentioned earlier, you see any kind of suspicious areas on you, probably want to give them a call. Dr. Phillips, thank you so much.
Thank you.
Appreciate your time.
Thank you.
Pleasure to meet you, Aaron. If you'd like some more information, you can call the number on your screen to Biloxi Dermatology Solutions here on Pass Road in Biloxi. They are just east of Keesler Federal Credit Union. Call, make an appointment if you have any questions about that, and be sure you take care of your skin. It is the biggest organ of your body.